programming for the Department of Health's daily COVID-19 briefing. Let's go ahead and listen in.
Please be advised that today's conference is being recorded. If you require any further assistance, please press *0. I would now like to hand the conference over to your speaker today, Ms. Andrea Oneman. Thank you. Please go ahead, ma'am.
Thank you. Good afternoon, everyone. Thank you for joining us for the COVID-19 media briefing for December 21st. On today's call, we have MDH Commissioner Jan Malcolm and MDH Infectious Disease Director Chris Erzman. We'll have each of them give a few updates, and then we'll open it up to questions from reporters on the line. With that, I will turn it over to Commissioner Malcolm.
Thanks, Andrea, and good afternoon, everybody. Around the world, the pace of growth of the COVID-19 pandemic continues at an alarming pace. An additional 500,000 cases, over 500,000 cases reported again yesterday, bringing the global total close to 77 million, with 1.7 million fatalities around the globe, adding close to 10,000 deaths a day in total. In the United States, similarly, we continue to add around 200,000 cases a day. Yesterday's number was a bit below that at 187,000 cases, but still in a single day, that's a rather stunning number. We're at 17.8 million cases now, over 317,000 deaths in the United States. That death rate has gone between 1,500 and 3,000 in recent days, 1,475 yesterday. Here in Minnesota, we are reporting an additional 1,998 cases today on yesterday's volume of 33,391 lab tests. This brings us to a new total of 399,311 cases since the start of the pandemic. The last time we reported fewer than 2,000 cases in a day was October 27th, almost 2 months ago now. And it's a good thing to note that we've now had a week of cases below 3,000 per day. We announced this morning another 21 COVID-19 deaths that were reported to us at MDH yesterday, bringing our total to 4,872 deaths since the start of the pandemic. 11 of these deaths were from the metropolitan area, 10 from greater Minnesota, ages ranging from 40 to 95. And 11 of these deaths yesterday reported were in residents of long-term care facilities. There are 1,040 people currently in Minnesota hospitals with COVID-19. Of those, 237 are in intensive care. Hospital beds in use continued the downward trend that we've seen over the last week. Overall, there were 270 fewer hospital beds in use for COVID care yesterday compared to a week ago. The 7-day average testing positivity rate was 8.9% as of Friday, the 4th day below the high risk level of 10% test positivity. So that too is a hopeful sign. We, as you know, watch these daily data very closely, but like to comment periodically on slightly longer term trends as well. And we'll do a little bit more of that today. The bottom line is that there genuinely are pieces of good news in these data. As what will be a massive vaccination effort slowly ramps up, we've seen a downward trend in new cases and hospitalizations and some stability in the numbers now. So that trend has continued long enough that we think of that as a genuine reduction in cases and not just artifacts of data reporting. This downward trend in new cases and new hospitalizations is very good to see. And we think it really highlights how people's actions to really take these precautionary measures to heart and to avoid the gatherings they would have loved to have around Thanksgiving, people's taking the governor's pause seriously are having a very positive impact. And we just want to acknowledge that and thank Minnesotans for their actions, which have clearly created some very important respite for our health systems and hospitals as they have really been working so hard to and maximizing capacity at every turn. For the past 2 weeks, we've had roughly 33,000 new cases in each of those weeks. The daily average rate of new cases is down by almost a half since we hit this most recent peak in the second week of November. And so we are roughly now at about 63 new cases per 100,000 residents each day. Now, this is certainly progress, but it's still a very high number of cases per population. As a point of reference, we started to surge into exponential growth around the time this rate of new cases per 100,000 residents hit 15. And again, we're now at 63. And we've talked before about the fact that 10 cases per 100,000 population is sort of the national benchmark for rates of growth that are considered controlled or not controlled. So over 10 new cases per day per 100,000 people is a marker of an epidemic that is not in good control. So we're still in that high risk situation as we have been reminding folks. And very sadly, while cases and hospitalization rates seem to be trending in a better direction, we did reach a new high in the number of deaths in a single week, with 424 deaths in the most recent week of complete data. On average, that's 2 to 3 people dying every hour last week. And sadly, we do expect to hit the very unfortunate milestone of 5,000 cumulative deaths in Minnesota this week. And this particular increase in deaths that we've been seeing follows that big surge in cases that we saw in November. I'd like to just call to folks' attention some new research that was published last week in the Journal of the American Medical Association, which found that among U.S. adults between the ages of 25 and 44, between March through the end of July, there were almost 12,000 more deaths in that age range than would have been expected based on historical norms. And that trend has continued into the fall. It was estimated that around 154,000 people in these age groups would be likely to die in 2020 based on previous trends. And that total was surpassed by November and is expected to reach 170,000 deaths in that age group by the end of 2020. And we see that in the data that COVID-19 is responsible for these excess deaths. I'm reminding of this just because we have a tendency to think of COVID-19 as a disease primarily or almost exclusively of a very serious nature for older adults. This is just a reminder that adults in these younger age groups can still be severely impacted by COVID-19 as well, that this disease is widespread and serious enough to have created that much deaths over historical norms in this younger population. And it's just another reminder of why it's so important to keep on modifying our behavior and avoiding gatherings, practicing social distancing, and wearing masks. We'll need to keep these actions up for a while, even as vaccines are rolling out. I mentioned that we've now seen the statewide measure for test positivity fall below 10% for the first time in almost 2 months, and that too is a good sign. And the testing volumes, testing rates are stable. So they're not as high as they were before the Thanksgiving holiday, to be sure. We're still testing at a very healthy level in terms of our population. While this downward trend is good, some of the regions in the state, particularly the central region, the south central, and the southwest, do remain above our high risk threshold for test positivity, which is 10%. And again, as a reminder, we want to see these numbers below 5% test positivity as another measure of whether the epidemic is in a state of greater control. This past weekend, we surpassed 5 million total tests that have been conducted in our state, which is really something to note. It's a big accomplishment and something we can be proud of, that we've built a testing infrastructure in Minnesota, which is very robust and a really great tool for us as we continue to manage through this pandemic. We've worked hard to offer testing without barriers, meaning that whatever hurdle might prevent someone from getting a test they need, we work really hard to remove that hurdle. Whether people have symptoms or don't have symptoms, whether they are insured or not, without cost barriers, by making locations more easily available, by addressing language barriers. All of these things have really been what we've tried to work on through our community testing programs all around Minnesota. We have more than 20 sites currently open to the public all around the state, along with the mail order program for our saliva testing program in partnership with Vault. This testing ecosystem, once again, we just want to give thanks to our local health systems, local public health, the Mayo Clinic and the University of Minnesota, along with Vault Health and IBX, our partners around the saliva program, that spent a lot of hard work to build up this amount of capacity, and it has served us well and will continue to do so. With the upcoming holiday weekends, we just want to remind everybody to really keep on being vigilant and mindful of the degree to which virus is still so very widespread in our communities, and why it's important, even though it's difficult, very difficult, to avoid gathering with all the people we would love to gather with at this time of year, but particularly in this very difficult year that's been heartbreaking in so many respects, but why it's still important to follow the guidance on gathering with very small groups, avoiding larger gatherings, following guidance on masking and social distancing. And if you are planning to see family or friends outside of your own immediate household, please do consider getting tested. We know young people are more likely to be asymptomatic carriers and have an increased risk of exposing others without knowing it. So we really encourage folks to take advantage of the many testing options that are available to you. You can look on the state's COVID-19 response website, look up your address, and find some testing options close to you. Just for your information, testing sites will not be open on December 24th and 25th. So closed December 24th and 25th, and closed again on December 31st and January 1st. So you can factor that into your plans if you're interested in seeking testing. Compared to other regions of the country, case growth rates in the Midwest, including Minnesota, have been higher on a population basis than we have seen in most other states over the course of this entire pandemic. So the upper Midwest has been experiencing a higher peak even than what we saw in the Northeast in the spring, or the South and the West in the summer. But among our Midwestern state neighbors, it does appear that since early December, our case growth, the population-based measure, is coming down faster in Minnesota than it is in our neighboring states, although we're happy to see the general decline in the Midwest as a region. But again, our case growth rate is coming down at a faster rate, which we credit to the hard work of Minnesotans and the sacrifice of some of our businesses. And now I'd like to pass it to Chris Erzman for an update on the vaccination program.
Thank you, Commissioner. As I think you may have heard, the FDA granted an emergency use authorization for the Moderna vaccine this weekend. And in addition, over the weekend, CDC's advisory committee, that we refer to as the ACIP, met over the weekend to issue guidance for administering that Moderna vaccine following the emergency use authorization. They noted that the Moderna vaccine has a similar efficacy and safety profile as the Pfizer vaccine. In addition to those recommendations, over the weekend, the CDC's Immunization Advisory Committee also voted on what groups should be included in Phase 1B for vaccination. We had initially expected that Phase 1B would include essential workers, and it does, but ACIP is now also recommending that people age 75 and older be included in Phase 1B. And so, and that's wonderful. This is an age group that does have most severe consequences from COVID disease. So Minnesota's Vaccine Allocation Advisory Committee will meet again to further sub-prioritize the federal guidelines as they did for phase 1A. And we're looking at the guidance that the CDC provided very closely. The Minnesota Vaccine Allocation Work Group will meet next week, and then again in January with the official Minnesota allocation recommendations coming out the week of January 18th. The Vaccine Work Group will help us sort out sub-prioritization within 1B. As you know, we want to make sure that all Minnesotans have access to COVID-19 vaccine, and that's our commitment. But because we don't have as much vaccine as we want initially, we do need to make prioritizations. Depending on the weekly shipment amount that we receive, we hope to be through vaccinating phase 1A by the end of January, but that is entirely dependent on the allocation that we receive from the federal government. The good news is that vaccine is in the state and we are getting more doses each week. We are vaccinating our healthcare partners, and as of yesterday, over 2,900 healthcare workers had been vaccinated, which is quite impressive when you consider that many of our healthcare sites didn't even receive their vaccine until Thursday or Friday. Our commitment to ensuring everyone who wants to get vaccinated and can remains. There are many factors to consider and address, and we know that people are very anxious to get vaccine, which is a good thing. There are many people who are very deserving of receiving vaccine early on, but with the limited doses right now, we're going to have to make some tough decisions for what order things will go in. So we just want you to be aware of that. Our desire would be that we had as much vaccine as we needed for everyone to be vaccinated. But because we don't, we will have to think about prioritization. It's a very fluid situation and things change. And I think you've heard over even the last couple of weeks that we've been talking about vaccination, that in both phase 1A and 1B, the ACIP made some changes to their recommendations for vaccination that we were not part of what had been proposed. In addition, our vaccine allocations have changed. So lots of things keep changing, and we are committed to keeping you updated, and we appreciate your patience as we navigate this together. But continue to be hopeful, because more vaccine, as I said, is coming into the state each week. And with that, I'll turn it back to Andrea.
Thank you. And operator, we are ready to take questions.
Absolutely. As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the # key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Theo Keith of Fox 9. The line is open.
Hi to you both. I have a few questions here. Maybe you can answer them in rapid fire. You had expected 46,000 or so Pfizer vaccines by late last Friday. Did Minnesota end up getting those? How many Moderna vaccines have arrived so far today? I know you expect 94,000 by the end of this week from Moderna. And you've mentioned a website a few times about so we can track vaccines. When is that going to be up?
I can start with that, Commissioner, if you'd like.
Yes, thanks.
Yes, we received 46,800 Pfizer doses last week, so we received the full allocation, and we are expected to receive, as you said, 94,800 Moderna doses. Yes, but they are being shipped starting today, so none of them have arrived in the state at this point. And we will be putting information on our vaccine allocation as well as doses administered in the days ahead.
If I can ask a question about sort of expectation setting. Minnesota vaccinated about 1,000 people last week. what do you expect for this week and next week? Could it ramp up to be 10,000 this week and 100,000 next week, or should people not expect that kind of exponential growth?
Well, this is definitely one place where exponential growth is a positive thing. I think to say that to see 100,000 doses administered in a week might be a lot, but when you keep in mind that providers really couldn't even start vaccinating with the Minnesota allocation until Thursday, they had to do training and do an attestation. So they could first start vaccinating on Thursday. And then, as I said, many providers didn't even get their vaccine until Friday. I think that, you know, we should expect to see many more doses in the days ahead. I'm just not sure that I would want to expect that we'd see 100,000 doses in a week.
Okay,
And that,
thank you.
and I say that, well, and I was going to say, I say that with the number of providers that we have right now. As more vaccine becomes available and we bring more and more providers on, that will definitely change the landscape. But right now, we have a focused number of providers who are providing vaccines. So I want to be realistic.
I assume you're expecting to get there sometime in January, though, if you think all 500,000 people in 1A could be vaccinated by the end of January.
Yes, we will continue to see increased number of doses administered.
All right, your next question comes from the line of Jeremy Olson of Star Tribune. Your line is open.
Hey, at the risk of being a broken record, I wanted to ask about the necessity of the current restrictions under the latest governor's order on bars, restaurants, and other businesses. I mean, as the data comes in, the outlook must change a little bit with each more positive sign. Have we reached a point where you'd conclude that maybe these aren't as necessary as they were even a week ago? Things do change that fast in this pandemic.
Well, this is the Commissioner. I definitely, again, I just want to reinforce how encouraging these trends are and how much we appreciate that the changes Minnesotans have made and acknowledge the sacrifices that these businesses have made. And we're delighted that not only the state legislature, but Congress has at least made some important steps toward providing the economic safety net that will help us not have to pit business survival against public health. Your question about whether the restrictions are still necessary, I guess I just again would point to the fact that though we've come down quite a good healthy pace in our case growth, we're still quite a bit above where not just we, but national public health leaders consider to be indicators of high risk for just a very widespread virus and fast growth. So we will continue to look at things like that case growth per 100,000 and test positivity and hospitalization metrics to assess how comfortable we are with just a level of viral activity in the community.
Follow-up question. You had mentioned our rate of decline being more substantial than in other states. Is that something that you have data to back up, or you can describe what time period or what information you looked at in more detail? I'd be interested to see how you reached that.
Sure. Chris may have some quantification right now, and if not, we can get it. But we just noticed the amount of our decline in cases per 100,000 compared to some of our neighbors. But as I said, we as a region, we're higher than most other parts of the country. But Chris, anything to add?
I don't at this point, no.
Thank you.
Your next question comes from the line of Dan Goldberg of Politico. Your line is open.
Thanks so much for doing this. The Congress appears on the verge of passing a stimulus package that will include roughly $9 billion for vaccine distribution for the states. Can you talk about whether that, I know many states have been asking for money for some time. Can you talk about whether that's sufficient and whether it's timely? I mean, is it, I don't want to say too late because I'm sure you can use the money, but how far down the process are you, and how will this help?
Well, Dan, we don't have the details yet, obviously, on exactly how that money is going to be allocated across a number of really important priorities. Certainly, direct relief to folks through extended unemployment, as well as targeted business aid, as well as funding for vaccine administration. As we talked about, we had flagged before that the future stages of the vaccine allocation are going to get into some very, large efforts that will require funding. So we're relieved that there's some funding for vaccination administration in the bill as well. So we just don't know how it's spread across all those priorities. And I think just about everybody would agree that that is not an adequate amount that's spread across the whole country, but a very welcome next step. And I think the economic relief to individuals and businesses, while it would have been great to have it assured before now, is certainly coming at a critical time, just as those benefits are about to expire completely.
And just if I may, can you, please.
I was just going to say, I'll just add that, as the commissioner said, for some aspects of the response, we wish it had been earlier. And even for vaccine, I suppose a little earlier might have been helpful, but we are in a phase right now in which a lot of the focus in phase 1A in the first tier is the healthcare setting where there are natural opportunities for vaccination. But as we expand out to do more of the population and need to set up vaccination sites to address gaps in service, that those resources will become more and more important. So for our local partners, our tribal partners, that will be really important for them to be able to do what's necessary as we move forward with vaccination.
Would you mind just expanding on that really quickly? When you say local partners, it'll be really important. What will they be able to do with that money?
Well, local public health and tribal health would be able to hire additional vaccinators. They would be able to cover the cost of their staff for doing, overtime and things like that. Because as we look at reaching out and doing outreach, there'll be both the clinical side, what happens in the traditional medical home, as well as with pharmacists, but we know that there'll be a need for additional vaccination beyond that. And so we need resources to ensure that that can happen, and this will assist with that.
Thank you.
Your next question comes from the line of Jeff Wagner of WCCO. Your line is open.
Good question. Was curious about the research maybe being done here on the variants of strains of COVID-19. Obviously, the big story out of the UK is there's a new variant that is spreading much faster than previous ones, leading to these shutdowns and other countries not being allowed to travel there. I was wondering how many different variants of the virus, if you guys are looking into that, have occurred in the Minnesota area or, Western Wisconsin, and what is your level of concern, if there is any, about these new variants based on what's happening in the UK as we are now just rolling out a vaccine? What is the awareness level of what's happening over there relative to here in Minnesota?
Chris, I'll start on that one, and then you can chime in. Yes, obviously we're all interested in that news. What we understand about the variants that are appearing in Europe and Great Britain in particular is that it speaks to increased transmissibility of the virus, makes it easier to spread, faster to spread, but not that it makes it more dangerous. So it's not leading to increased severity of illness or increased mortality, but rather greater ease of spread. We certainly have seen pretty significant ease of spread in the variants that we have here. So we're not sure how much more easily transmissible they're talking about, but it is important to note that it is not an indicator of more severe disease. One thing I will share with you is our state public health laboratory truly is one of the leading labs in the country and tends to be on the front end of a lot of new science. Our laboratory is a leader in whole genome sequencing and has been already routinely scanning for looking for new variants. So as new variants occur, we will be able to spot them, and we are on the lookout for them. Chris, I don't know if you have any quantification of the number of variants we've seen yet, but we do know that in an RNA-based virus like this, I'm told, I'm not a scientist myself in this area, but that mutations in this particular type of a virus are not all that surprising. But Chris, do you have anything more you want to add?
I'll just mention that when they look at the type of mutation, it is in the spike protein on the virus, and so we'll be watching for what this means for vaccination. But at this point, feel that the vaccine will continue to be effective against this virus.
And just to quickly follow up from what I was reading, the researchers in England had known about this variation since September, but they needed many months of research before they were able to pull the trigger and say this is something that is of a concern. As Janet said, that you guys are routinely scanning for new variants. Are you able to quantify a certain number? Has there been 2 or 3 or 4 different variants in the Minnesota area? And are there any in particular that you've been monitoring closely for a period of time just to be sure it's not going to lead to an increased spread or a faster spread similar to this one over the pond?
I would have to defer to the laboratorians that are doing that whole genome sequencing. I think that it's a situation in which you can have slight variations and slight mutations, and then what you need to see is this really taking off to be something different. But we can certainly connect you with our public health laboratorians who are doing this work.
Thank you so much.
Operator, we have time for one more question.
I think your last question comes from the line of Jeremy Olson of Star Tribune. Your line is open.
Yes, actually, my question was answered, so I'm okay. Sorry about that.
Again, if you want to ask a question, you need to press *1 on your telephone keypad.
And I think that's all the time we have for questions for today. So we'll have to end it there. But thank you very much to all for joining us. If you did have a question that wasn't able to be answered, please feel free to reach out to our media team at Minnesota Department of Health. Thank you.
That was today's COVID-19 briefing by state leaders. Department of Health Commissioner Jan